Entrepreneurs, business owners, professionals who seek excellence, bringing the business classroom to you. It's the Business Builders Show. Here's Marty Wolf.
We still got a long way to go. Yes, we all got a long way to go.
Welcome to the Business Builders Show with Marty Wolf, the show for entrepreneurs, business owners, and business leaders. I'm Marty Wolf, your host for the Business Builders Show, and along with my executive producer, DC Taylor, we will be your guides on this learning journey. Let me tell you my super objective in being with you today. I want to enthusiastically share stories and information to inspire leaders. And if you're listening to this podcast, you are a leader, so you can inspire others. My guest with me today is Nisa Amoyles. Hi, Nisa. How are you today?
I'm great. How are you?
You must be busy. So let me say this before we actually begin. So we are recording this interview with Nisa the second week of April 2020. The world has been disrupted by the COVID-19 pandemic. We fully expect this discussion with Nisa to be valuable right now and in the future. So Nisa, I'm going to tell people your website right out of the gate. It is nisaamoyles.com. Am I correct?
Correct.
All right. Now, she is a venture capitalist. She's been early in the blockchain and subscribes to the convergence theory that blockchain underlies most areas of disruptive innovation such as IoT, autonomy and robotics, artificial intelligence, augmented and virtual reality. Nisa has been named to the top 50 Global Fintech Thought Leaders, Business Insider list of 30 women in venture capital to watch, and top 100 women in fintech in 2019. She also wrote a great book called WTF is Happening, which stands for Women Tech Founders on the Rise. So Nisa, well, thanks for coming back on the show. We are going to talk about an article that you wrote that is extraordinarily timely in what's going on in the world. The title of that article is Technology and Data, or Data, however you want to say that, are the new weapons in the war on COVID-19, in parentheses, coronavirus, by Jane Thomason and Nisa Amoyles. Nisa, we're going to talk about that, but I'm going to read the first sentence in this because I think it sets up our discussion. The pandemic is the first real test of futuristic and disruptive technologies that have been in development for decades. So talk to me, maybe give me the overview of the article, Nisa.
Yeah, absolutely. First of all, thanks for having me back. We had a blast last time talking about my book. We're all in lockdown right now, so it's a little bit of a different time, but we wrote this article because we felt it was really important as everybody was doing social distancing and washing their hands and feeling like what else could be done in this war against the virus. We wanted to highlight all of these different technologies that have been accelerating for a while but are now converging in different ways and how they are being used in this war. And just in general, how these technologies can be used for social good, which is something we talk about all the time. So everything ranging from robotics and drones to artificial intelligence to blockchain to 3D printing.
Let's go at them one at a time. First of all, I think if we had a lot of these technologies further advanced, at least in the United States, we'd probably be in better shape. Now, that's my own editorial comment. That's not Nisa's comment. But let's start right down and let's go right in the order of the article, because I think it's a great way to approach this discussion. The first thing you talk about is a crisis of trust and media. Talk to me about that.
This is the first time we're all in this kind of situation where we have social media, and a lot of people are on social media searching for the truth, and there's a lot of fake news out there. So a lot of companies have come together, particularly using blockchain technology, to be able to figure out what the scores and ranks of trustworthy social media accounts under an algorithm to map out the actual epidemic and who to follow on Twitter. So I think that's really, really interesting. A lot of people don't trust what the data is, what their news sources are reporting, who are relying on the data. So it's a matter of using blockchain to turn to this data source and then authenticate the data sources that are coming in from multiple places. And, blockchain just makes that immutable and tamper-proof.
Why does that happen? Why is that statement true? I want you to tell me what Hive is, but then answer this question first, I guess. Why is blockchain the methodology or the tool, whatever words, to help us get the current and accurate information?
Well, it's basically a distributed ledger technology, and it can be accessed from multiple places, and it is immutable, and so the data cannot be tampered with. Now, that's on the assumption that you have to have good data going in, because you could get garbage in, garbage out as well. I think that it makes it all more trustworthy because it's based on mathematical equations. And once it's there, it's there, right? It can't be changed.
What's Hive? You mentioned, by the way, folks, I'm going to read the title of the article again. All the information we talk about and more, we won't get all this, is the title of the article is Technology and Data Are the New Weapons in the War on COVID-19, in parentheses, Coronavirus, by Jane Thomason and Nisa Moyles. So you can find that, just look that up. In the show notes, I will have the link to that. Tell me what Hive is, Nisa.
Can you read the sentence where I talk about Hive?
A group of crypto-minded researchers, engineers, designers, and fans of the space that scores and ranks trustworthy social accounts has developed another algorithm to map the actual, I can't say that word, epidemiologist to follow on Twitter.
Right.
So what's that about?
So again, a lot of people in crypto and blockchain were already working in a decentralized manner. So this work from home situation is not that much of a change. They were already working in consortiums, groups of people coming or companies coming together. And so Hive is just one of those examples. Another is not mentioned in the article because it came out after, but it's called MiPasa. And it's a coalition between IBM, Microsoft, and Oracle, and the World Health Organization, Johns Hopkins, and the CDC, Center for Disease Control. So it's very similarly, they are trying to aggregate data from different clouds and be able to authenticate that data and make sure you can use blockchain to track the spread of the virus, the number of testing kits, the number of new cases.
Tell me the name again and maybe spell it for me so I get it right.
It's MiPasa, MiPasa, MiPasa.
Okay, got it. Okay, so artificial intelligence obviously should be and is, I guess, playing a big role in technology and data being one of the new weapons in the war on COVID-19. So talk to me about what you see in terms of artificial intelligence and how that's affecting things.
One of the biggest trends that has emerged from this is the concept of telehealth, or diagnosing symptoms from afar without being in person with a doctor. And that's really where artificial intelligence is playing the biggest role, I would say. All of these startups that are facilitating that, one of them actually takes it a step further. They provide crowdsourced patient diagnoses to nearby hospitals so they can send the right patient to the right hospital and manage overflow, which is one of the biggest problems here in this pandemic is managing hospital overflow. But basically, you would give somebody your symptoms, and then based on other people who have given similar symptoms, they can, they're careful about calling it a true diagnosis, but they can direct you based on what you're seeing to the right place. And that cuts down on a lot of risks of, just meeting in person and trying to diagnose in person. Yeah. An average coronavirus patient has more than 2,000 CAT scan images during their hospitalization, and the amount of work that is required to manually read and compare the image data from every patient is just cut down by using artificial intelligence and speeding up that process and avoiding errors, and then, speeding up treatment.
So the intelligence learns as it's taking information, it's learning, and it obviously can expedite the answers that the patient or the doctor needs. Great time to really get that into full swing. A couple more points that the idea of surveillance, I guess, is probably a big topic. I would think, because there's big data and surveillance is overall a big topic. But how do you see that in terms of being a weapon in the war on COVID-19?
I think, Panasonic is one of the companies that's using facial recognition, like Face Pro, to identify people who are wearing masks, or people with, like they can scan the body temperatures. And
tell your temperature.
Yeah,
Right.
Yeah, exactly.
Yeah.
And so I guess, that would help with cracking down on the lockdown, like who's supposed to be in lockdown and who may be violating the lockdown, or tracking the spread based on, who's wearing masks. The other way is, I think in Israel, they're using aggregated and anonymous mobile phone data to do that. And, to warn users from engaging with other people who might be infected. Obviously, all of this, as you point out, raises the bar in terms of living with privacy versus a surveillance state. And because we're in a time of crisis, have people's attitudes towards that changed? Are they more willing to give up their privacy now in order to get the accurate information? And if they are willing to, is that just temporary, right? Or is this going to become a permanent surveillance state?
That's what's going to be discussed very diligently in the next few weeks and months. But countries like South Korea and China are using a lot more of these tools than we are in the United States. Am I accurate in that?
Yeah, absolutely. They're way ahead in these technologies. And so I think, even as the outbreak was only in China for a while, there were, tons of startups that popped up to use all these different technologies to try and combat the virus. And, here in the United States, there are some, but it seems to be mostly the existing big tech companies that are getting on board. I'd
be willing to bet that many of us are wishing we had all this in this time. Again, after it passes, who knows what we'll be talking about or seeing. Again, Nisa Amoils is my guest. Her website is nisaamoils.com. Her last name is spelled Amoils, nisaamoils.com. And the title of the piece, again, that I'll put in the show notes, is Technology and Data Are the New Weapons in the War on COVID-19. Fascinating paper, fascinating discussion. Maybe the last point, there's so much to talk about in this, Nisa. I love the thing about 3D printing. It's kind of a space that I've been following for a while. So talk to me about that as something that's really can be very helpful in times like this.
Yes, I'm sure you've read about all the 3D printing of masks that are happening with this shortage of supply. But thought it was really interesting that in Italy, they were 3D printing valves for hospitals, for equipment. I think it was like Volkswagen who was doing ventilators. And there were a lot of companies transitioning to producing ventilators, but they had a testing of their supply chain to see how they can use 3D printing to speed up the production. So I think we'll start to see this being more commonplace, 3D printing, and we'll start to see all these technologies. I think this is, the genie's out of the bottle, and we're not going back to not using them.
Yeah, leaders like you are terrible to say it this way, but it's kind of like you may be sitting there saying, I told you so. Why didn't you pay more attention? You're probably thinking that. Maybe you won't say that publicly, but I could see that, I personally wish we were further ahead on this. So talk to me, the last thing that we want to talk about again, because I know you have a very busy schedule, and I know you're in demand on big channels and all that kind of stuff. So talk to me about business and academic institutions and how they're chipping in about technology, data in this whole pandemic. Relate business and academic institutions to this discussion.
Yeah, so we talked about Johns Hopkins providing data. That a lot of people are following their data, the World Economic Forum, and also private companies like Alibaba. They established the Global Meta Exchange to help combat the outbreak. And this facilitates online communication and collaboration across borders and provides frontline medical teams around the world with secure communication channels to share experiences. They also offer overseas Chinese citizens who are affected with AI, big data, and cloud computing capabilities.
Whole new world we're entering, Nisa. You're going to be my go-to for all this information. You're ready for another interview shortly down the road?
Well, we didn't get to talk about all the robotics and drones that are doing
I know.
dull and dangerous tasks here.
If you want to take a minute and talk about it, go ahead. If you have 5 more minutes or 2 more minutes, go ahead. Talk to me about it.
It's fascinating to me is that these robots are being used to disinfect hospital rooms, communicate with isolated people, take vital information, deliver medications. And, drones are, you've probably seen them flying all over the place these days, but they're spraying disinfectant or they are patrolling public places, again, thermal imaging and making announcements. Like I saw a drone in New York City flying the other day saying, please stay inside.
Really?
Yeah.
Wow. Yeah. Wow. Yeah, I'm glad you did bring that up. So much going on. We interviewed a guy named Jeremy Frank from a company called KCF Technologies, and what they do is they put sensors on machines so you can see how the machine is healthy or not. And they're implementing all these different things in this transition. They're already in the cloud, measuring data, but now they're using all these other new techniques so that manufacturers can keep going. I mean, it's a vital need. I mean, that's another thing that's happening, not only the things that you're talking about, but the urgency and the importance of manufacturing in America and worldwide is so critical. So, yeah, fascinating. So you are my go-to on this, Nisa, so be ready for a call when I need you, okay?
Absolutely. Anytime. It's always a pleasure.
All right. So Nisa Amoyals is my guest. Again, go to nisaamoyals.com. I did mention her book that you'd want to pick this up to. Her book is WTF is Happening, which is Women Tech Founders on the Rise. Nisa, thank you so much for being part of the Business Builders Show.
Likewise, thank you.
Bringing the business classroom to you. It's the Business Builders Show with Marty Wolf.